And so I'm going to get started because recording is in progress. So thank you everybody for attending. We want to go ahead and get started as soon as possible. I know there'll be lots of questions. And so I want to give you guys sort of the ground rules of how we're going to do our town hall today. So we have two speakers and they're going to each take a few minutes to talk about their areas, and I'll introduce them in a second. Dr. Didwani and I, who I'm also going to introduce in a second, we will be monitoring the chat. Many of the questions that you submitted in preparation for this town hall will already be incorporated into some of the comments by our speakers, and then we'll be monitoring the chat and getting, after those presentations are done, we'll sort of facilitate those questions to make sure that we're getting the pulse of everyone here and getting those questions out to our panel here. So my name is Kim Bates. I am a program director at Dignity Health St. Rose Dominican, get my own program together, in Las Vegas, Nevada, and I'm one of the members of the AAIM Council. I'd like to introduce Ashish Dawani, who is also part of our AAIM Council and program director and vice chair of education at Northwestern.
Thank you. Thank you, Dr. Bates. Good morning and afternoon to everybody. And we have a boatload of questions to go over with you guys, and I'll turn it over to Dr. Bates to welcome our speakers.
Great. So we will be your moderators, and I'd like to introduce our two speakers, and I'm going to introduce them in the order in which they're going to present. So first is Patrick Fritz. He is the Senior Director of Admissions, Selection, and Application Services at the AAIMC, or as I said, Senior Director of ERAS. And Jason Riminek, who is the CEO and founder of Thalamus. So they each have a little bit of presentations, in many ways guided by some of the questions that you guys had, and then we'll move forward to anything that is left over. So if you have questions as they come up, please go ahead and put them in the chat. And Patrick, I will hand it over to you.
Great. Thank you, Kim, and good afternoon, everyone. I'm going to just pull up some slides here. I have some slides I'm going to share, and then for a quick overview, and then I'm going to turn it over to Jason to talk about the product. Okay, can you all see the slides now? Great. And I believe we'll be handling Q&A through the chat, and we'll do our presentation and then come back to that if that's okay. But thank you very much. I'm really excited to be here, and I'm really excited for this partnership with Thalamus. I started in this position overseeing ERAS, the operations of ERAS 2 years ago. And I spent the first few months really going around talking to a lot of programs, schools, different representatives from specialties, a number of folks from AAIM, and really heard a lot of great ideas and changes. But really, from this community, I heard a few things. One, we want to decrease applications. We want applicants that align to my program, and we want tools to make it easier to review. And so why am I so excited about this partnership is that it really has the ability to deliver this and to build on the work that we've been doing the last couple of years. A lot of that in partnership with you all. And I want to thank Dr. Parsons for really being collaborative and connecting us to the right people as we've embarked on a lot of this work. Other folks include Dr. Swales, Dr. Wallach, Dr. Raz, of course, Dr. Bob Ficalora, who is a member of the ERAS Advisor Committee and who have helped and provided feedback along the way. When we started this partnership, we really had, IAM key in mind. We knew there was already high adoption of Thalamus, and we really wanted to bring change and innovation to internal medicine. And now we really want to work with you to make this transition smooth and successful. And so I'm going to share a couple of slides. So today we really want to provide an overview of our collaboration, high-level timeline of implementation, share some product views, and of course, answer any questions. Just a little bit of background. As I mentioned, when I started in ERAS a couple of years ago, we went out and really set a strategic direction and focus, given all the change that was happening in the transition to residency space. And we really want to focus on selection tools, a suite of product and tools that support the fellowship and residency community that are adaptable to change and meet the needs, especially around holistic review. We want to be providing data and analytics back to all users, not just programs, program directors and program coordinators, but to institutions, to advisors, and especially to applicants to be making informed decisions throughout this process. And then finally, where can we be leaders, or where can we partner with folks to drive change in this space? And so I want to share with you kind of where we've been and where we're going over these past 20 months. Really, there's been a lot that we've developed, and we worked with about 40. We conducted about 44 focus groups and working sessions, most of those with representation from internal medicine, to deliver the new application that was put in place this year that included signaling, geographic preferences, and new experiences. We've delivered new data analytics dashboards to DIOs. DIOs can now see across their institution and what's happening in different programs. This week, we delivered our dashboards to advisors so they can better have a sense of applicant behavior and how they should be advising. And then finally, we're going to be delivering at the program level analytics through Thalamus, through Cerebellum. Collaborative innovation is working. We've seen a decrease overall in average applications this year for the first time in 10 years. We've seen 13 specialties have large declines between 5 and 30%. We haven't seen IM decline this year. We have seen a decline in MD average applications. It's about the same for DO, slightly up in average applications, but there is an overall increase in IMG applications. And we see that as an opportunity to address this through this partnership, and also through working with IMGs to better guide them to make selection. And we think that our partnership also with other groups such as NRMP, NBOME, NBME through the Residency Explorer, and we're going to be delivering new analytics tools and selection frameworks in Residency Explorer next year, which will really help applicants make better informed decisions when applying. So just before I move on, I do want to address a couple of questions about just ERAS and the application itself that have come up that I saw that were part of the registration or part of the registration. Firstly, I do want to say, if you are experiencing a technical issue or something, that you don't think you should be seeing through a filter or through a screen, please call the ERAS help desk. We can have one of the product people kind of call you back and walk through that. I know we've done that with a number of folks in internal medicine this year that had experienced some technical issues. With regards to the application content, we made a lot of changes this year for this cycle. Obviously, I talked about some of those: signaling, geographic preferences, others. We're going to be making fewer, not as large changes, but still some changes. One around publications and renaming that to scholarly work and allowing applicants to highlight their top 3 publications. We're going to standardize the collection of higher education institutions. So it's going to be a drop down. So you'll be able to kind of filter more easily on that, as well as the field of study in their undergraduate education. Language fluency, we're only going to be collecting languages where applicants are proficient in, so there won't be that proficiency scale, and also some changes in membership, honors, and awards. And so we're going to be sharing those final changes late this year or early next year. And so we're happy to do another webinar or provide some materials directly through our contacts at AAIM to get that out to the programs. I know one other issue that had come up was around hobbies and the changes in hobbies. So that section was now folded into the experiences section. So applicants still have the ability to add hobbies. However, I know that there were some programs that were interested in having the whole hobby section back. And to be honest, some schools and advisors have also asked for that. So that's something we're evaluating. We will likely not change that back next year, but we're going to watch, and our research team is going to look very closely at the need for bringing hobbies back. So I just wanted to make sure folks said that, because there were a number of questions about hobbies. So, again, why does this collaboration make sense? Maximizes the opportunities to drive innovation. Really, it's us being able to leverage the premier interview management tool in the GME space. As I mentioned, a lot of programs have already adopted Thalamus. Now you get it for free. And we see the ability of bringing the data together, decreasing that fragmentation that drives things like data analytics and gives us a better picture for advisors and institutions and programs. It's a catalyst for more innovation. So this is really going to create a foundation that empowers the AMC and Thalamus to move more quickly. We'll be able to do more collaborative research. and address the evolving needs of our applicants. So as I mentioned, you have seen previously ERAS stay very stagnant for years. We no longer want that to be the case. We want to continue to evolve and meet the evolving needs of the residency community. So in this collaboration, institutions will be, our DIO analytics is going to be replaced by Cerebellum. That's the Thalamus product. It'll have the same data, same information. At the program level, you'll have access to Interview Scheduler. So we're going to sunset the ERAS scheduler and replace it with Core. And there's going to be integration between the two. So you'll no longer have to do the bulk uploads. That's going away. There's going to be integration between the two systems. So I want to be very clear about that because a number of questions came in about the challenges of bulk upload. And so that was for this year only. So next year, again, the data will be able to move in between Thalamus Core and the PDWS. Itinerary Wizard, that's the itinerary builder. I know many of you are familiar with this. And then Cerebellum, it will be the program level data analytics tool that you'll be able to see your program's trends, how it trends previous years, and also against national data. So really excited to be bringing that to the program level. I want to be very clear here that all of these things are free. There is no intent to charge for any of this. I have heard from a number of folks that, maybe we'll be charging in a year or two, or maybe we'll start charging applicants. That's not the case. This is this is all going to be free for programs. And just something else to notice too, we are revising the ERAS fee schedule. So I wanted to let you know that costs will be coming down for applicants that apply to on average, costs will be lower for applicants that apply to programs. So we're excited to announce that in the coming months as well. So I'll stop here and I'm going to stop sharing and I'll turn it over to Jason.
Thank you, Patrick and Dr. Parsons and AIM and everyone for having us today. We're really excited to be here for Thalamus. For those of you that don't know me, I'm Jason Remenick, CEO and founder of Thalamus. I applied to residency in 2012, got stuck in New York City during Hurricane Sandy. Many of my residency interviews were canceled, and that was really the major driver and catalyst for the creation of Thalamus. My co-founder, Dr. Susie Karen, is an anesthesiologist up at the University of Rochester, who's a program director and also an associate DIO. And so we've tried to build a solution over the last 10 years. We've worked with internal medicine programs for over 9 years now as well, to really drive innovation and change and provide software solutions that help with this process. We're really excited to be working with the AAIMC as part of this collaboration, and I'm excited to be here today. There were a number of questions that we received from the pre-registration. I'm going to try and go through many of those as we go through the materials today as well. This is the main Thalamus ERAS collaboration page. AAIMC has a similar page with similar information. This is the mission control of all of the information that we have about the collaboration itself. We continuously update this. It has an overview, it has the press release, it has FAQs, which we're updating. As Patrick said, 3 of the 5 Thalamus products are Core Interview Scheduler, the Itinerary Wizard, which builds the schedules, and Cerebellum, which is the data and analytics dashboard that we've built both for programs and institutions. All of that is included complimentary in the collaboration. This will be complimentary as part of this multi-year collaboration. This isn't a first-year teaser rate again. This is the way we expect it to be, and it will be. What's available for an additional fee is Cortex, which is our screening and application review tool, and Thalamus Video. Thalamus does integrate with Zoom, Teams, and WebEx via API. There's lots of different ways to use any of those with Thalamus, and there were some questions about that I'll review today also. But we also have our own video interview platform as well. So whatever solutions you want to use, we're more than happy to work with you, support you, etc. So there were a lot of questions about just how do we get more information. This page is one way. There were a lot of questions about, well, what's going to happen with this integration going forward as well. And so over the next year, as Patrick already alluded to, ERAS Scheduler will be sunset, and Thalamus Core is going to be the main interview scheduling software going forward, used as part of this collaboration. Similarly, the ERAS Analytics for DIOs reports will be rolled into Cerebellum, and there will be those reports as well as other reports available at both the program and the institutional level. Over this next year and for ERAS 2025, which starts next July, our development teams are doing a significant amount of integration work, APIs. And so the software is going to be connected. And I think there's been a lot of questions about, well, what does that mean? And what we're trying to do is provide a really streamlined experience for programs, because prior to AAMC and Thalamus coming together, the only way to move data was to export data out of ERAS, either as PDFs to upload into Cortex or as a CSV file to upload into Core. That is staying that way this year as we build out this fully integrated solution. But for the next year, we really want to make that process more streamlined. So you're in PDWS. If you're using Cortex, you want to review some applications there. You select the applicants, you select the data fields, you click send this to Cortex. That data shows up in Cortex with the entire application. Similarly, whether you use Cortex or not, if you want to just get the applicants that you want to interview into Core, you select those applicants and you move it into Core. So that's how the data is going to move. There's also going to be some data flowing back into the PDWS as well. So it's going to create this entire streamlined ecosystem. We're working with programs. We're going to continue communicating out what this looks like as we continue to build it out and continue to educate everyone. So there were questions about, well, is it automatically going to move data? No, it's going to be user triggered. So you only need to move the people and the data that you want to move. And other questions just about, well, will the data be streamlined? And so, yes, it will be streamlined. It will be much easier to move the data. There were questions about, well, how are we going to log into all of this? And so while as the two systems will remain separate, we are building in what's called a single sign-on solution. So you can log into Thalamus with your ERAS credentials. You can log into Thalamus with your Thalamus credentials. For those institutions that use our institutional single sign-on, you can log into Thalamus with your institutional credentials. We're trying to find every which way to make it as easy and as frictionless as possible for people to log in, use our software and our various platforms as well. And so this integration work is really the foundation and the key that excites me just on the technology side, because we spend a lot of time historically making sure the data moves each year. ERAS changes a few fields, Thalamus has to update itself. ERAS changes a part of the application. In specialties want to do different types of program signals and preference signals and geographic signals. And now, yes, we have to do that work, but we're able to do that work collectively, collaboratively on the front end to ensure that it works super well for the community. And that's what we're looking for the future. And so that's what I wanted to talk about in terms of the API overall. There are questions from the community too, like, well, what about photos moving into Thalamus Core? One of the reasons we built Cortex is because it could ingest PDFs and it can take all the photos in bulk. Now that we're building an API, the photos will freely move to both systems as well. And so all data is going to move much easier, and it's something we're overall super excited about. The next question that I know is particularly important to internal medicine, given the size of the specialty and the number of tracks that everyone has, is, well, why don't the tracks auto-populate into Cortex and Core? And this, historically, the reason is we came up with the idea of a track in Thalamus, and an interview track is used somewhat differently than an application track. Now that we're working together, we've started reaching out to programs, some IM programs, and programs across other specialties. Next year, as we build this API, we're working to incorporate the ERAS tracks into both Cortex and Core. And we're going to handle our tracks in Thalamus with just a different name. So that way, all of this data will flow freely. I know that's very important to the IM community because of just the size of the programs, but also just the number of people in each track and how faculty review those applications. So we were at the AIM conference in Baltimore. I had lots of conversations with lots of program directors and program coordinators. Like, we are hearing you. We are building this. That work is already underway in just these few short weeks. It was already on our roadmap, but we know it's just very important. And so we're prioritizing that work as well. We talked about that, and we talked about tracks. And so then there were questions just about, well, about the analytics, what about bias detection, AI work, what data is being shared, et cetera. We're working with the community to figure out what are the things the community wants. We are presenting this week and into next week at the AAMC's LSL conference in Seattle. We're going to share a lot of some preliminary data from this year. We're excited about that. To me, really a major value of this partnership overall is the data, because it can provide insights to the community. We know from research papers that we've written that geography is very important, particularly in primary care, as to what drives the match, and same state geography being that most important feature. Did the applicant grow up in your state, or did they go to medical school in your state? Creates a very high likelihood that the applicant will match within that state. But we've looked at other things. We've looked at interview hoarding and the lack thereof in orthopedic surgery. We've looked at the proposal of the early match in OBGYN and how that affects the match overall and the implications for that, to have those discussions at the national level. And we want to work with the specialties as well to figure out what other questions and research questions can we work with you on. Cerebellum could very easily be turned into a specialty-wide dashboard that could provide specialty trends year over year. And that's something we've been having discussions and conversations with as well. So I'm here because, one, I want to help educate the community, but two, we want to just talk about where we can drive this technology and this innovation for the future. Another big question we got is just, well, how does training work? We've built a lot of training resources. Several of my team members who are on this call, former program coordinators and administrators. As I mentioned, my co-founder's a program director. I've been in GME as an applicant and on the resident side. We really are passionate about this community because we're from this community. And we've built a lot of training mechanisms to do that, to help new programs get started this year. This is our training page. You can click on the training button at the top of our website. Getting started with Thalamus. This was inspired by the collaboration. This is the basics to get you up and running on Thalamus. This was run live. It was so popular, we decided to record it as well. So you can now view this asynchronously. This is free, as are all of our live group trainings, which are run on a regular cadence weekly. They go through all of the different components of Thalamus and every single one of our products and features. They are completely free. You can join as many as you like. If you haven't opted into Thalamus for this year, you're still welcome to join us. We're just trying to share information and educate the community. Additionally, if you want to look at it more asynchronously, all of these are pre-recorded, and we have them in asynchronous format as well as what we call snippet videos, which are more in-depth videos on our website, and the various features and products on our website. We have some paid options as well. We have an advanced certification training seminar. This is to create super users in Thalamus. It's a multi-day Zoom training across everything and every nook and cranny of Thalamus, led by our amazing customer success team of former program coordinators and administrators. Comes with a demo account, counts towards TAGME certification, and really helps train users in every single component of Thalamus. Additionally, we have institutional specific training as well, and these are paid options too. So however much or little you want to learn Thalamus, we're here to support you. It's really important for us that no one feels forced to do anything. This is not about being forced. We think there's tremendous value to applicants scheduling their interviews in one place. But if you're using a different tool outside of Thalamus and ERAS, you're more than welcome to do that too. We want you to be excited about using our software. We want to find value in it. If it's not helping you find value, let us know. This is how we build. This is how we've built for 10 years. We really do love feedback. That comes to our help button down here. If you ever have a question, you can fill out our contact form. It goes right to our customer support team. You can search our user guide here. You can provide us feedback within the product itself. Our links to our very detailed user guides for both applicants and programs that have arrows and photos and all of these different tools and different ways to learn. We've seen program coordinators and administrators and directors who are brand new to their role and brand new to GME use Thalamus with success. We've seen coordinators, directors, and 80-year-old faculty use Thalamus to success as well. Like, we love working with everyone. We've worked with just about every size and shape of institution, geographically and otherwise, and we're excited to continue to be working with the community in this way. We talked about the help button. There are questions about test environments. And so there are things you can test in Thalamus in your current account if you have Thalamus, but we heard from the community that they want to test more things, particularly our video. So we're building a test function to test our video. We're building other ways to test our various softwares as well. And so we're working to set that up too. And so we hear you when you tell us things. We talk about it. We bring it back to our teams. We follow up. And there are questions about just, how can we use Thalamus and how can we broaden our use of Thalamus in the future? And we have lots of account managers and other people on our team who can help institutions and our programs with that growth throughout the platform as well. So we're super excited about that. The other question we had was, well, how do we help educate applicants on this? And so this is a newer resource that we added, but we have a page now just for applicants too. We always had a user guide, but we've kind of brought this to the front in terms of, we have a checklist that's super handy for applicants to learn how to use our software. We have this resources guide and all of our user guides for the applicants. They can use the Thalamus on the web. They can use Thalamus via their mobile phone for both iPhone and Android. We have trainings for applicants. The next are coming up November 6th and November 27th live, but it's also pre-recorded and can be watched at any time. We've even aggregated a lot of the coordinated interview release dates across specialties as well to make it easy for them to see that. We have a nonprofit too, called thalamus.org that provides grants to students who are underrepresented in medicine to defray the costs of applying to residency. And that's something we're super excited about. And there were some questions about that too. And I'm happy to talk about that today also. And just ways to stay updated to Thalamus. We're active across several social media platforms with applicants and programs. And so we're really excited to just work with more of the community because we love being a part of this community. And so that's our applicant resources. We talked about training, and there was questions about costs. As Patrick said, the complimentary items are complimentary. Applicants, we do not charge applicants for any service in Thalamus. It's not really in our mission or vision to do that. I did this because I was an applicant and I know what this process is like, and I've seen now and worked with hundreds of thousands of applicants across the process. There are ways to streamline this process while making this affordable, and that's one of the reasons we created the nonprofit as well. And so, we talked about that. There's a lot of questions about enhancements and updates. One thing I did want to touch on also was there's a lot of questions about Zoom, which we know a lot of programs are using Zoom overall. Zoom can be connected to Thalamus in a lot of different ways. You can connect Thalamus to Zoom, Teams, or WebEx via an API. So you go into your account, you hook it up. When you build events, it will auto-generate Zoom links, Teams links, WebEx links, etc. Some have asked, well, we want to use breakout rooms. Can we do that instead? Of course. So you don't have to, if you're going to go down that route, you don't have to connect Thalamus via an API. You can create your Zoom link. You can share it in your schedule within Thalamus. Your applicants can access that single Zoom link, and then you can run your interview day as you would within Zoom. However you want to run your virtual interview day, we want to make sure we can support that for you. We have programs that are using Thalamus video and Zoom for other things as well, or Zoom and Teams, and all different combinations. We've seen just about every which way this can be done. We want to be able to support you and help you through that as well. And the other big piece that I just wanted to talk about was just really where the collaboration has gone to date, and just kind of talk about the overall success in medicine as well. I had pulled up, disappeared, but we know that 441 internal medicine programs opted in to use Thalamus this year, which is about 67% of programs that entered the match last year. And here it is. That accounts for 276 internal medicine programs that have already sent out invites through Thalamus as of last week. That's over 60,000 interview invitations. To date, Thalamus has sent out about 300,000 interview invitations this season. And so the 60,000 in IM are about for about 140,000 spots that are currently in Thalamus. So about 44% of interview invitations have gone out that we have in our system. And so we're just quite excited about that overall. I think it's really great statistics. Again, we're going to present more data as we enter LSL and at the conference next week and then beyond that. But I think there's just a lot of really good data that we can work together with the community to share in terms of research, in terms of how this process is going as well. And so there are a few other things I wanted to touch. I'm sure they'll come up in more questions, but I think it's just really important for us to continue having these conversations with specialties at the national level to say, we are here to support you. We brought a lot of our team members. We want to find ways to make this transition easier. For those of you that have joined us this year, we're thrilled to have you. For those that are gearing up to work with us next year, excellent. For those of you that are hesitant to join us, come talk to us. We will help you work through this and decide if it's right for you. And if it is, it's fantastic. If not, again, no one should feel forced to use our software, but we want to provide value so that you really want to use it.
Well, thank you, Jason and Patrick, for laying down some fantastic background about both products that we are dependent on using successfully. So I'll start with the chat questions. You guys covered both a lot of the questions that were submitted in advance of this town hall. So thanks for reviewing those and already fitting those into some of the comments you've shared. Patrick, in particular, the hobbies. I think we get excited about hobbies. So Kim and I are going to go back and forth, going through the chat and covering questions with probably a few comments that might need some clarification. We'll do our best to follow everybody that's submitted in the chat and see what we can do. We've got about 25 to 30 minutes. So the first question, and I think we all know that sometimes these questions will be redundant because we just need to hear the answer again to really understand it. So excuse Kim and I if we're repeating some questions that you might have already answered. All right, the first question. How can programs get direct access to program analytics this year without having to go through the DIO?
So there's no right now there's no ERAS analytics at the program level. That's going to be introduced next year through Thalamus for Cerebellum. So those using the Thalamus tool, all programs actually will be able to get program level data through Cerebellum starting next cycle.
Yeah, and if you're using Thalamus now and you have access to Cerebellum through the collaboration, that data is there for your program for this season currently and updates every day.
Perfect. Thank you.
Yeah.
Okay, so I'll take the next one. So what specific data right now is being shared with applicants and with others about programs? And I think this is maybe a question, I'm assuming this is more an ERAS question, because correct me if I'm wrong, Jason, I don't think there's communication back to the applicants about stuff that's in Thalamus from programs, but I will leave that open to both of you.
I'll let Patrick start and then I'll fill in the rest.
Yeah, sure. Thanks, Jason. Thanks, Kim. There's, obviously applicants are going to many different places for program level information and for program level feedback. Our goal is to really drive them to Residency Explorer. We want that to be the one-stop shop, and that is that's a partnership between the AAMC, NRMP, NBME, NBOME, ACGME, and others that are collaborating through data to share program level information. So because of the application change this year, we don't have the same data to be putting into Residency Explorer this year. For example, the change to pass-fail, the changes in experience. So it's very high-level data that we collect, obviously, through registration and what we have. But moving forward, there's a few things that we're working on with our partners for next cycle that we're looking to deliver on. One is a comparison data related to experiences, program signaling, geography, and other variables for an applicant to be able to look at a program level type snapshot in Residency Explorer. We're looking at a competitive index that enables applicants to understand the probability of an interview invitation at a program based on their application and applications like theirs in the past. And then finally, an alignment tool. So changing the ERAS registration process to collect more detailed questions from programs that allows applicants to identify programs based on applicant and program program input. So not only do we have the historical data, but also as programs think about who they might be looking for this upcoming cycle, you're going to be able to enter that information into ERAS program management, and applicants are going to be able to look and see how a program might align with their values, and vice versa. Programs can see how an applicant may align with their mission and their values. And then just to point out, a lot of this data will be driven by the partnership that we have in Thalamus, obviously, because together now we'll have likely 90% plus of the interview data, thanks to this partnership, and especially the usage within internal medicine. Jason, anything you want to add?
Yeah, I think just for clarity purposes, like everything Thalamus does abides by the match rules and guidelines. We don't share anything about applicants other than, the programs about programs. We don't share anything about applicants to the programs or the programs to the applicants and vice versa. So you're not going to see other programs that applicants apply to. The applicants aren't going to see any data that you do on your end of the Thalamus platform. We have very strict data governance and policies. That's why we had very long conversations with the AAIMC to put this together. And we know that data is very important to this community. We do not sell data. Anytime we report on data, we do so at the aggregate and the de-identified level. I'd encourage anyone to go look at our research papers, because I think it looks to the level of care that we put into de-identifying data when we share things like that. This isn't about any one person. This is about helping the community understand what's going on with the process. And we've had questions about this on demos, and is the data safe? The data is safe. It is encrypted. We are a software company. We have penetration tests and data governance and data security as well. So when we talk about data sharing, and I think a lot of what we're talking about with the data with this collaboration is, we've done a lot of research. The AAIMC has done a lot of research. None of us have had really the full data set and the full population. But this year now, we already have 67% of IM in Thalamus. You put that together with the IM programs that are in ERAS this year and ERAS' scheduler. This is a large component of internal medicine, which would obviously be the single largest data set of the application and interview process that exists. And so these are the questions we want to answer. What does the distribution of interviews look like amongst applicants? We have a very good idea working with the 30-ish% of programs we have over the last decade or so. But now we have even more data to help answer those questions. And so when we're talking about data, we're talking about it from the academic level. We're talking about it from the value of providing it to the community. And we have very high standards to the point like, yes, if we don't have an N of 10 in something, we don't report on it, because we don't want people and or programs to be identified. This isn't about ranking anyone. This isn't about helping programs get the scoop on other programs individually, but better understand where they are in this process, how they can improve it for their program, for the applicants, how they can improve it for themselves as well. And I think that's a lot where we're pointing in the future and where a lot of the value is. But we are incredibly careful about this, how we deal with this, how we use the data, how we process the data. We have many academics on our side, PhDs, et cetera, who built their careers doing research. And so this is a major focus for us, because this is a very unique process, obviously, and applying to residency. And we really think the data can help drive a lot of these discussions, from everything from just making the process easier to everyone, diversifying the process, finding better equity in the process. And that's a lot of what we're focusing on for the future.
Can I add one piece to that?
Yeah, sure.
Sorry. And this is again why we're partnering with Thalamus. We talk to a lot of vendors, but it's this data integrity, but also the fact that Thalamus is solely invested in this arena in GME, and making change and innovation and driving positive behaviors by all participants. And so just we see the data together as being able to drive that change.
Thank you. So we still got a boatload of questions, so we'll keep moving along here. You both addressed cost, and there's a couple questions around that. I just wanted to maybe reiterate that. Are there going to be any services that do cost programs, or will everything from the ERAS end or the Thalamus end be free?
I just want to a few things on that. Everything I showed with regards to Cerebellum, the data analytics, and Thalamus Core, which will be the new ERAS scheduler, there will be no charge. through this partnership. So I want to be very clear about that. There's not a charge next year or the year after or the year after. We that is part of the ERAS portfolio being driven by Thalamus. So there will be no charge to programs. Just to clarify too, also charges to applicants. As I mentioned, we're looking at the fee schedule, which will likely come down for the majority of applicants. And also we're soon announcing a fee assistance program, which is an expansion of the AAIMC's AMCAS and MCAT fee assistance program into ERAS. And so that's something that you'll see more information about soon as well. So also reduced cost to applicants.
Great, thank you both. I'm going to go on to the next question, which is really more of a technical one about reporting. So I know there's been some questions, some answers back and forth in the chat from the rest of the team members, and thank you for that. But I kind of wanted to get it for everyone, and this really goes around the tracks. And Jason, you mentioned this a little bit in some of the feedback you guys have gotten about being able to identify the tracks. But for those folks who are really trying to pull reports based on applicant track, currently, what's the recommendation for the best way how to handle that until the integration is changed for 2024?
So on the Thalamus side, we have tracks, which help set scheduling permissions. So that's one way, because those tracks can be filtered on. They have to be set by the program, but that's one method. We also have a tagging feature, which is a labeling kind of post-it feature, which isn't connected to the scheduling behavior or scheduling permissions at all. And that's another way to do that. And you can filter on things there. All of our data is exportable. All of our data also archives year over year. A lot of that data obviously is pulled into Cerebellum too. Those would be my basic suggestions for this year. But again, next year, we are focusing a lot more on track. We spent a lot of time whiteboarding out how tracks work. Some programs invite based on track, some do not. There's very varying behaviors. So we wanted to find a very comprehensive solution for all the programs across all specialties. Again, medicine is a major focus for us, just given the specialty's significant reliance on track. And so that's kind of where we're focusing, but there's a lot of different tools and ways to filter things based on track and export data along that regard. And our team can help with that too, if you have any questions about it.
Excellent. All right, our next question is about geographic definitions. If it's state by state, why do they have them signaled by regions, especially huge regions like the South, where Maryland is nowhere near Texas? I know this has come up before in some of the conferences. So Patrick, maybe if you want to jump in on that.
Sure, thank you. And I apologize for not addressing that earlier. That was one I really should have addressed. I know that came through. So those are based on some census data on the regions, seven different regions. So that was the original part of the supplemental application. Having state level, in talking with our partners at NRMP and others, we want to make sure that applicants can have enough choice. Now, we know that those are very large swaths of areas and very variably along a scale in location, but I do want to point out one thing. There is the ability to write about why you selected that region, and I know that has been a very valuable resource for internal medicine, especially for IMGs, both for programs and for IMGs to be able to show that connection. I've heard a lot of anecdotal evidence of programs selecting applicants, reviewing applicants, interviewing applicants that they otherwise would not have interviewed based on that information. So with that said, we're not necessarily wed to these 7 regions. So similar to hobbies, these are things we want to watch for a couple of years. So now it's been, I think, 2 or 3 years. The AAIMC's research team has this high on priority to be reviewing and looking at and determining, are there better ways we could be segmenting the country or developing regions that might make more sense for medicine than they do within the census. So I want to be clear that all these things are open to continue to evolve. The whole application, this is not something that's going to stay stagnant again for 10 years. We want to evaluate it. So we welcome feedback, and we do, the idea of states is something that others have talked about. So thank you.
Thank you. Okay, Kim, back to you.
All right, back to me. So I'm going to skip one, and there was an important question that I want to make sure we get in, which is, and this is really an ERAS question, which is about standardization for the things that applicants put in as far as their higher places of higher education and most recent residency programs. It sounds like there's ability for the applicant to do a little bit of free texting there, which can actually make it difficult for programs to actually understand what that information is. So I was wondering if you could talk a little bit about what things are in the works, or if there's things moving forward in the collaboration that will help with some of those standardization of program names, hospital names, those types of things.
Yeah, I'm gonna call a friend here. I'd like to call on PJ Kenya. He is the director of product strategy for ERAS and for AMCAS. And PJ can talk about kind of what we've done and what's in the works. And I just want to say this too, that standardization is something that we are looking at across the application, so that to your point, Kim, it's easier to be able to look at, it's easier to filter on, it's easier to find. PJ, are you able to talk?
Absolutely, and I appreciate that question in the chat. And Kim, I'm glad we are able to speak to it here. As you all know, the MyERAS application was relatively stagnant up until last year, when we really started to implement some changes. And one of the key changes is standardization, really trying to move away from open text fields, which are difficult. It results in the sentiment shared in the chat, and it's difficult for programs to interact with that data or to do things with it outside of the system. And so last year, we added some standardization, such as hometown, which you all are seeing this year, which is now a standardized data set, or other geographic locations. For the upcoming season, as Patrick mentioned, we're adding standardization into higher education institutions, so the undergraduate and graduate schools. And from this chat, I actually already have a live chat going with the teams that are doing this work for us, to really look at what can be done around the training programs. That wasn't something that was being evaluated and considered this year through this round of changes. But clearly, between the residency data and fellowship data that we have, certainly data exists to allow for things like training to also be captured in that structured, standardized way. So I appreciate you all calling that out. I can't speak today to know whether we'd be able to include that with the changes that we're planning for ERAS 2025, or if that will have to come in a subsequent year, since we're just now talking about this. But do know that across the application, wherever there's an opportunity to add standardization to improve the efficiency for applicants and to improve the quality of the data for programs, that is one of the cornerstones of what we're using to identify opportunities to strengthen and improve the application. So we will follow up with more information once we know more about this particular training section of the MyERAS application.
Fantastic.
Right. Yep. Thanks, Kim. And thanks, Patrick and PJ. So I'll jump back to a question for Jason. That's a technical one, and I think you guys are developing and evolving. I'll tackle that one, and maybe I'll group in a second one that's both related to some of the technicals around Thalamus. Thalamus's ability to email back and forth with applicants. And a second question, I think different but maybe related, is the ability to survey not just applicants, but survey faculty interviewers.
Yes, great questions. So Thalamus, there's lots of ways to communicate with applicants. We have an entire email page that allows you to set up all different types of emails: invitations, confirmations, cancellations, waitlist emails. We have multiple interviews, we have social events, we have automated reminder emails, we have other additional templates you can send that you can send through Thalamus. You can also email candidates by selecting them on your dashboard and clicking send email, and then it opens up their email. And so there's been more discussion now that we're working with a broader audience. Well, should we send rejection emails from Thalamus? Would that be helpful to programs? What other ways can programs communicate? Similarly, on the faculty side, we've had this question about faculty surveys. New this year was we went from just kind of an interview day kind of survey about what are your research interests and what are any dietary restrictions or what faculty member do you want to meet with, to both now a post-interview and a post-match survey on both an anonymous and anonymized and a non-anonymized way to send those as well, and the applicants can answer it on their end. I think the next iteration we were looking at is, yes, how do we survey faculty? We have a faculty availability feature as well that I think needs to evolve, and we've heard that feedback as well. And so we're looking at that for the coming year plus. And so, yes, all of these things we have questions about that I know in the pre-work. They're going to be video enhancements. We're consistently enhancing our video application. And there was questions about screening and scoring. And there is a question in the chat now about what we're calling scoring 2.0. And so we saw that programs score applicants very differently. They use Cortex and they use Core incredibly differently as well. We are very big proponents of holistic review, and so we've spent the last year plus working with the community to develop what we're calling scoring 2.0, which is being used by a handful of programs right now in beta and will be available for more of a general release in the coming months to the rest of the community. But it brings this entire kind of competency-based model with scorecards, questions. It brings in Cortex scores, interview scores, overall scores. But essentially, programs can add competencies. Within those competencies, they can add questions. There's new types of scoring in addition to just the categories, which you can build in Thalamus today. There's drop-down scores, free response, level-based competency, milestone-based scoring, yes, no, etc. You can write notes still. You can define ranges. You can for the Likert scoring, define the actual categories and what they mean, very similar to how residents are rated in the RMSs as well. And this all rolls into various scorecards that can be sent to different faculty members. You can have different weighters, different reviewers have different weights within the way their scores are counted. You can even then define how all of this raw data rolls up then into an overall aggregate score and have them average and have them sum. And so this was all of the scoring feedback that we've gotten from the community over the last few years rolled up together, because we know academic medicine loves data, particularly in internal medicine. We built out even a math tab that shows you how all the math is added across a very complex kind of Excel model with a lot of math powering this on the back end. This rolls into Cortex assignments for faculty and applicants, and here. And where is this assignment page? Oh, here. And so you can assign applicants and faculty to assign to different groups of applicants in Cortex. And all of these scores will roll across the system. It will roll data in terms of smart scoring. It'll roll data in as a ways to have inter-rater and intra-rater reliability. And so we know the community is always looking for innovation, as Patrick alluded to in the beginning. We are consistently building. We did our last kind of major release at the beginning of the residency season. We have a more minor release coming out in the next few weeks. We are also doing tweaks and other things here and there that's happening on a weekly or bi-weekly basis. And so we love to hear this feedback, because that's what helps us build our product roadmap and where we grow and go from there. And so I just wanted to show that, because it seems like there's been a lot of questions about that overall, because programs want more people to be able to score within Cortex. That already exists within Thalamus. Cortex was kind of built originally as a single kind of program director going through a lot of this process. Now there's a lot more people involved, and scoring 2.0 kind of imagines that. And so I don't want to monopolize the time here, but I thought it was just important to address the amount of enhancement and updates that we're working on at Thalamus, along with the AAIMC, along with the community, to just build more tools to help solve the challenges we know programs are having in managing this very, very complicated process.
Thank you, Jason. And one quick addendum to the first part of the question. Can applicants reply back to the program using Thalamus email?
Right now they cannot. It was something we've always been asking ourselves for years. Do programs want applicants to reply within Thalamus? If that is something y'all are looking for, please let us know. It will open up discussions on our end to reopen those discussions with programs. The community changes over time. In the past, most of what we heard was no, but if that's changing to yes, like it's something We actually built that years ago. We just never released it, kind of like on LinkedIn, a LinkedIn kind of chat module.
Yep. Thank you.
Yeah.
So this will probably be our last question. And so this really gets to the integration across programs that have both residencies and fellowships that they're using Thalamus for. And so I don't have fellowships, so I don't know this. I don't know how it works, but apparently there's the ability to have some duplicative entries when you have faculty who might be interviewers on the residency side and on the fellowship side. And so is there something in the works to kind of integrate these so that you don't get duplication of the same faculty member being listed 3 or 4 times because they're interviewing for multiple core residencies and fellowships in the same institution?
So if they're an applicant, they would only appear on the program's applicant dashboard. If they're a reviewer for another program, they would be in that program's administration tab. That's how kind of our enterprise permissions are set up. Our system is set up as such so that you can be an applicant and a reviewer for a program or an interviewer, and that should all be managed fine. I guess I get there's probably a specific question under that I don't know I'm fully comprehending here, but it should be able to manage all of that now.
Okay.
Yeah.
Well, thank you, Kim, being a great co-moderator.
Yeah.
Thank you, Patrick, Fritz, and Jason Reminick for your comments. And we're going to try to capture some of the questions that we didn't get to and find a way to follow up.
If I could quickly address just one other question, because I think it's a question that a lot of people have been asking, kind of more asking about the economics of Thalamus, the mission of Thalamus, where we're headed with all of this, why we have a nonprofit now as well. And I think it's just important. And one of the reasons we came together with the AAIM is we're a very mission-driven company. People ask, well, you're funded by venture capital. Yes, we are. We're also funded by very social impact-driven venture capitalists like the Cape Port Center and Cape Port Capital, whose mission is to invest in startups that close gaps of access for all. And so there were questions about DEI and how Thalamus is handling this too. And I think one of the reasons when we sat down with the AAIM why this all came together was we're working on research, we're doing data, we're from the community. Obviously, the world is changing in terms of how we can measure DEI as well. Talking about distance traveled, we build product at Thalamus in a very inclusive way. We're also made a major commitment to accessibility as well, which we'll be rolling out over the coming years too as part of this collaboration. And so we're here because we really care about this community. We formed a nonprofit because we saw that there were equity gaps in students having to pay to apply to residency and gave out over $50,000 there. They're separate organizations with very different missions and very different entire infrastructures, but all within this common mission of diversifying the healthcare workforce, making this process easier, aiding applicants through this process, et cetera. And so at the end of the day, we're happy to continue talking about this. We think it's very important. We very much mean all of this and what this is coming from and where we are going in Thalamus. We talk about our mission more so than we talk about any of the economics at Thalamus. And I think our team would agree with that also. And I think that's why we came together with the AAIM and why we're excited to be partnering with this community. And so we really appreciate being involved in these conversations because I think it's important to continue to tell this story and what Thalamus is and what it's trying to do. And overall, that's kind of why we're most excited about the future. To us, it's all about patient care, ensuring that the doctors can get to the patients at the hospitals and that those downstream patient interactions, which ultimately result in better patient outcomes, starting at this residency recruitment process and continuing on, that's what gets our team up in the morning and building what we're building. So I appreciate being able to be here.
Well, thank you for that, Jason. And thank you again, Patrick. So I'd like to welcome in our president and CEO of AAIM, Dr. Polly Parsons, to close out the town hall. Dr. Parsons.
Yeah, thank you. So I just particularly want to thank Aish and Kimberly for stepping in as moderators on pretty short notice and putting this together. Also to Sheila Costa, who really did all the background logistics of getting it. I also want to thank everybody from both Thalamus and ERAS who've been really responsive. And also just to let everybody on the current meeting know that this came as the result of, you all have your definite chats and forums, et cetera. We started to see that people were having some questions about these, sort of the integration of these two products, et cetera. We immediately called both organizations and said, hey, it looks like there's some opportunity to help answer questions. And I appreciate their coming together very quickly to really help with that. And I think we now have ongoing opportunities to communicate. You all seen that, you ask questions, we can get answers, you can get answers. And I hope we can continue with that in a very exciting way. So thanks to everybody who participated. Thanks particularly to moderators. Thanks particularly to our colleagues at AAMC and Thalamus, and special shout out to Sheila, who, when I said, I think we need a quick webinar, and by the way, it's going to happen right when AAMC is trying to get to their meeting. Can you make it happen? And she did. So thanks to everybody.
Thanks, everybody. Have a wonderful rest of your day.
Appreciate it.
Take care.
Thank you all.
Thanks, everyone.
Thank you.